I'm giving you 3 ways to get rid of fatty liver disease fast. That is right. I'm also going to give you a specific diet that will help you kick fatty liver disease to the curb. Guys, I'm Dr. Jen. I'm a practicing family physician. It's good to see you. All right. Now, when we say fatty liver disease, we are talking about metabolic dysfunction associated steatotic liver disease. Such a mouthful. Literally it is. But basically, it means fatty liver disease, or rather the syndrome of having fat in your liver, and also high cholesterol or high blood pressure or diabetes or obesity, and little to no alcohol consumption, okay? Now, I'm not going to go into the nuts and bolts of this syndrome, what we now call fatty liver disease, and the severity, and there's all sorts of stuff. Let's just get to the 3 main ways to fix it, okay? Because I know that's why you're here, and this is really what I want to give you. Number 1 is you have to treat the underlying or any underlying diabetes, high blood pressure, high cholesterol, etc. You've got to treat that. So if your doctor's like, hey, got high blood pressure, we got to get on this, please get on it in ways that they suggest, that you work together. Same thing with cholesterol, same thing with diabetes. You've got to treat these things to help your sort of fatty liver disease, the metabolic dysfunction associated steatotic liver disease, okay? The next thing is minimize alcohol. Now remember, people in this category already do minimize alcohol. So woohoo, you're already ahead of the game, but you want to keep that to a minimum. The third thing, and this is the one, this is the kicker right here, lose weight. Huge. 10% of your body weight if you can. Ideally, if not more, if you need to lose more. This is probably one of, if not the most important part of beating fatty liver disease. I kid you not. Remember, when we talk about fatty liver disease, it's fat in the liver. I often say to my patients, hey, look, fat goes everywhere in the body, or can, most places in the body. It can also go in the liver. And when fat gets into the liver, it can cause other problems. I'll link another video here about sort of more about the condition, etc. All right, but losing weight. Now, let me give you the diet that I think can be really, really helpful. This is according to the American College of Gastroenterology. And in addition to that diet, I'm going to give you sort of the ingredients, like what they recommend, but I'm also going to recommend a diet called the Mediterranean diet and also a diet called the DASH diet, okay? Now, for those of you watching on Facebook, you're going to have to message me asking me for these videos because they don't link on Facebook like they do on YouTube. On YouTube, I'm going to link the videos to this so you'll be able to find them on the cards, the in tags, etc., okay? All right, Mediterranean and DASH. Now let's talk about things that you can incorporate in your diet to help with fatty liver disease. First thing is to avoid sugary drinks. I always say don't drink your calories. Don't drink sugar. Even that's things like iced teas, juices, sodas that have sugar in them, lemonades, all that stuff. It really, really, really is a problem. Number 2, sweets and added sugars in general. We're talking about packaged donuts and biscuits and muffins and things with added sugar, candy, cakes, and stuff like that. It's not that you can never have this stuff. You just want to keep it to a minimum. The next thing is fried foods, fatty foods, and snack foods, okay? Also, I think that things that are sold in packages, like, for example, in New Jersey, I work in New Jersey, and there's like a Wawa. For those of you familiar with Wawa, shout out to Wawa. It's like a convenience store, right? And this is not just Wawa. Many of them have this, but packaged things, prepared things, may not be the best because they may have preservatives. That's not so much the problem here, but they might have lots of added sugar, sodium, etc., and other ingredients, cholesterol, etc. So you want to watch that. Next thing is watch your portion sizes, okay? Do not eat too much, folks. Watch that. And then a couple healthy snacks a day, and then a good kicker is 2.5 cups of fruits or veggies a day can be very, very helpful. And one of the things I think is most important is a nutritionist. Oftentimes insurance will pay for this. You got to ask your doctor for this. Oh, and not just a nutritionist, by the way. In addition to, like, when my patients have this condition, I am doing a workup, getting a liver ultrasound, all that kind of stuff, but then I'm referring them to a gastroenterologist or a hepatologist, a liver doctor, to help kind of guide their care. And remember when we talk about weight loss, so I said lose weight, 10% of your body weight if you can. That doesn't just mean healthy diet. For some people, that could also mean like GLP-1 medications. That can mean bariatric surgery. That can mean that you join a gym and get a trainer. That can mean so many different things, right? And remember, we have a lot of different modalities to help keep your weight in check. What I want you to know is that you can do this. You can do this. I promise you can do this, okay? Just hang in there. Work with your doctor. Try the different modalities that they're recommending, but understand that a lot of this you might be able to turn around. I don't say everything is 100% because there's some situations where it may not be able to be turned around, but in a lot of cases, you can turn this around. Guys, I'm Dr. Jen. Please follow my page on Facebook. Please subscribe to my channel on YouTube. I'm on TikTok, Instagram, LinkedIn, WhatsApp. Please subscribe to my newsletter at drjencaudle.com. Love y'all.